The main challenge for mental health care today, one is access, and the other is stigma, which actually makes engagement very difficult. We need to change the perception amongst employers and housing authorities about our patients. The Interfaith Medical Center is unique because it's a place where we have a community hospital, which at the same time has very strong academic base and a very challenging patient population. And our doctors and nurses and our administrative staff are just excellent. In fact, during the Joint Commission survey, the surveyors were so pleased and they said, you guys have great DNA, and that is doctors, nurses, and administration. On the education side, I have Dr. Olupona, who joined us from Mount Sinai. Very strong background, came in, trained child psychiatry in Columbia and did her undergrad at New York University. And she has really helped us in creating a brand new psychiatry residency program that is really doing well. The residents are going to the APA this year with 11 posters and 1 workshop, and have done a number of publications.
Interfaith is actually a combination of 2 hospitals in the past. This one used to be Brooklyn Jewish, was very well-known academic center in Brooklyn, and St. John's. They were then fused into one institution. That's why it's called Interfaith.
So we have trained our staff and patients in the use of narcan kits. Narcan kits are used to save lives in patients who overdose from opioids such as heroin. And this is huge for us and because of the opioid epidemic here in New York State and I think across the country. And we think it will improve the care of our patients and save significant lives. So we're very proud of that. We have also done other stuff in the research area. We have 2 studies that are going on, one in the genetics of bipolar disorder and the other looking at ADHD, attention deficit hyperactivity disorder, for patients with substance abuse. Reducing the length of stay in our emergency room has been a major project for us, and we did what is called a lean project. And after improving the processes and putting in the new system, we were able to reduce that length of stay to about 7 hours now. So it's been a major success for us.
The Integrated Center for Mental Health, we also call it ICMH, is a SAMHSA-funded program.
We provide services to clients who have mental illness, who have been neglectful in seeing their medical doctor. We provide wellness groups, health physicals, health monitoring.
So Interfaith is partnering with a lot of community organizations because we want to make sure that we have a presence here. There are some schools that have approached us to partner with them, to work with the teachers so that the teachers can learn how to destigmatize psychiatric illnesses, mental illnesses, and also strategies as to how to help children who go into crisis and who have behavioral difficulties in the classroom.
Here at Interfaith Medical Center, I'm the chief psychologist and also the unit chief for our partial hospitalization program and our intensive psychiatric rehabilitative program. So IPRT is Intensive Psychiatric Rehabilitative Program. That's also a day program. That's another one of the gems at Interfaith Medical Center because there are very few of them around. So in IPRT, the practitioners focus mostly on one of 4 goals, which is either going back to school, whether that's getting a GED or even going to college, getting a job, socializing, or housing. We help people apply for housing and deal with case managers and people who are really specialized in that area because a stable home is very important for your mental health.
When they come to us, they get the physical, they get the initial assessment, and then we create a plan just for them to lead a healthier life.
Interfaith Medical Center gave me a new lease on life. It gave me the tools and the knowledge to maintain myself clean and sober. Today, I am 3 years clean. Had it not been for Interfaith Medical Center, which saved my life, I don't think I'd be here today. The city and state can do a few things to improve it. First of all, they should reach out to the community leaders and the churches, such as the priests, the pastors, the imams. Let them know what services are available to their community. Teach family members not to turn your back on them. That's when they need you the most.
So in the future, one of the things I want to focus on as chief psychologist is helping to strengthen the educational component of Interfaith Medical Center, our training program. Professionals can learn from each other and also how it can strengthen the services we deliver to our patients.
All the members of APA, they can come and have a look at it. This is a center of excellence, and they can look at how we take care of the patients and provide education in both behavioral health and primary care.
We actually got 2 best practices. One was for our discharge practice on the inpatient by our social workers and the entire team, and the other one for the outpatient service for the modality in which we admit and assign patients to therapists. So we're very proud of that. The mission of Interfaith Medical Center is to provide the best medical care, education, and research for the population of Brooklyn.